as we start off, there's some things that we need to know about. How does our body react to heat, and how does our body dissipate it? So things to know about is thermoregulation. This is primarily controlled by the hypothalamus in our brain, and what it's doing is it's trying to control homeostasis and keep everything on an even keel. We have heat regulating activity by either perspiring or shivering. So as we perspire, that will allow the sweat to evaporate off of our skin and cool us down. And then if we are shivering when we're cold, that will actually increase our body heat. So it's a stimulation of the peripheral thermal receptors in the skin, and then it helps change blood temperatures as it flows through the hypothalamus. We have internal heat regulation, which means that our body gains heat from either the environment that we're in or heat that's generated from our muscles during activity. And then we have radiation, conduction, and convection. So radiant heat is meaning that we have a loss of heat from a warmer object to a cooler object via an infrared wave. So this is what we call our thermal energy. And with radiation, our body temperature is normally warmer than the environment that we are in. So radiant heat is dissipated through the air that we're standing in to the surrounding objects that we may be by. So if we're warmer and that object's cooler, we're going to be able to dissipate heat that way. If the temps of the surrounding objects, such as like artificial turf, may exceed our skin temperature, that means that we are going to absorb radiant heat, which causes a problem, especially for football players on that artificial turf. You're going to start absorbing that radiant heat because usually that turf gets really, really hot. And then we have conduction, which is a direct transfer of heat through either a liquid, solid, or a gas. And again, it's going to run from a warmer object to a cooler object. And this can also be a problem for standing on artificial turf. So now you're going to be standing on this turf, participating in this turf. You're going to have radiant heat, but then you're also going to have conduction of heat too. And then the rate of that conductive heat is going to depend on what is the temperature difference between you and the object. And then the other thing is if we're in contact with water and it's cool water, it's actually going to cool our body off very efficiently. Last is convection, and convection depends on conduction from the skin to the water or to the air surrounding it. So usually it's pretty effective if we have the body in cold water for ice immersion or cold immersion, or if there's a nice breeze, or if we have a fan blowing on us, that's going to help dissipate heat. So if the air moves very slow though, and we're standing in very stale, stagnant air, then that dissipation of heat is not going to be very effective. Evaporation is probably the most effective heat loss for our bodies, and with evaporation, it's basically as we sweat and that sweat is on our skin, it's going to evaporate off of our skin, and so it's going to help cool our bodies that way. The total amount of sweat that gets evaporated, though, is going to be dependent on a few different things. One, it's going to be dependent on how much skin surface is actually exposed to the environment that we're in, the temperature and the relative humidity of the ambient air that we are participating in, and then convective air currents. So if it's, again, stale, hot environment, stagnant air, not moving a whole lot, really no breezes, then we're not going to be able to evaporate that sweat off our skin very efficiently. Relative humidity is probably one of the most important factors with evaporation, and with relative humidity you're looking at the ratio of water in the ambient air to the total quantity of moisture that it can carry at a certain temperature. So if the humidity is super high, that means that there's a lot of moisture already in the air, which means that it's going to be less effective for our sweat to evaporate off of our skin because that ratio is too close. It's too close to 1-to-1, so it's not going to evaporate very well. A couple of things to keep in mind is when people are in those hot, humid environments working out, you can lose up to 3 to 6 pounds of body weight per hour from just sweat and evaporation. And then to also really keep in mind is that dehydration can occur when you have 1 to 2% of body weight lost due to this. So that's one thing, is to make sure that people are staying properly hydrated during activity. And then if you lose greater than 3% of your body weight with dehydration, that actually now predisposes you for a risk factor of experiencing other exertional heat illnesses such as heat cramps, exhaustion, or stroke. One of the ways that we can measure the relative humidity in the air is using what we call a wet bulb globe thermometer, or temperature, and we use that, and then we create what is called the heat stress index. So measuring for ambient air temperature, humidity, and then solar radiant energy in the environment, we have a wet bulb thermometer and then a regular thermometer that's encased in black, which is going to absorb that radiant energy. And then that can help measure your temperatures in the environment that you're in. We use what's called a sling psychrometer, which measures heat stress by exposing a dry thermometer bulb and then a wet thermometer bulb. So it's going to help see what the relative humidity is in the air. And what we look for is what's the difference between the two temperatures. If there's relatively no difference between the wet bulb and the dry bulb, that means that the humidity is very high, so we're not going to be able to evaporate that sweat very efficiently off of our skin. Wet bulb globe temperature risk chart, you can find this in your book also, takes into account the wet bulb globe temperature and then lists the level of risk and comments on activity. So as that level of risk gets higher, we really need to take into account of how can we change this activity. Can we move it to a different time? Do we really need to just cancel the activity altogether because the environment's not going to be conducive at any time of day? Do you need to have more water breaks? Maybe if it was football practice, instead of being in full helmets and shoulder pads, maybe they're just doing their practice in shorts and a t-shirt. So there's different ways that you can modify to help run an activity still in a hot, humid environment. Some factors that can modify heat tolerance, one of the big things is acclimatization. So moderate exercise and heat exposure can result in psychological adaptation to the environment that you're in. And by becoming acclimatized to the environment that you're in, it's going to improve your performance and improve your heat tolerance. Usually heat tolerance takes about 10 to 14 days with proper hydration for your body really to become acclimatized to the environment that it's in. But you can also lose it very rapidly. So 1 day lost for every 2 to 3 days without activity in that heat exposure. So this can be kind of important when you have somebody with an injury that may not be able to do full practices with the team. You don't want to leave them inside doing things in a controlled environment. You want to make sure that they're still outside, what they can do activity-wise outside, that they're doing that, so that they don't lose some of that acclimatization that they may have already gained. The other thing to really take into account is proper hydration. Like we said, dehydration can cause major problems and predispose you for other heat-related illnesses, but it really deteriorates circulatory and thermoregulatory efficiency of our body. So our body's really not able to maintain homeostasis very well if we start dehydrating ourselves. So then usually thirst is the first sign of dehydration. So if somebody comes over and says, "I'm really thirsty," you already know that they're dehydrated. Some good rules of thumb is that pre-exercise you want to drink about 17 to 20 ounces of fluids 2 to 3 hours before activity, and then 7 to 10 ounces 10 to 20 minutes before activity. And then during activity you should be drinking about 7 to 10 ounces every 10 to 20 minutes. And of course that time frame may be a little bit lower. You may be taking water breaks every 10 minutes on the dot if you are concerned about that heat stress index that we had on the previous slide. And then post-exercise, you need to make sure that you're rehydrating within 2 hours of exercise. And not just rehydrating with only water, making sure that we're rehydrating with carbs and electrolytes. So Powerade, Gatorade are two good options for rehydration. You could also measure urine output and then also looking at urine color. So if you have an athlete that comes in and says, "Yeah, man, my urine was really dark, it looked like apple juice," you know that they are dehydrated, and you need to make sure that they are ingesting more fluids to get them properly hydrated before their next activity. So that's something to really keep in mind and have the athletes kind of keep track of it on their own. Other things that can modify heat tolerance is carbohydrate replacement, making sure that you are ingesting Gatorade, Powerade to make sure that glycogen stores are increased for optimal performance, and just electrolyte stores are there. Clothing-wise, making sure that you're working out in light-colored and lightweight clothing, so not having really dark, hot, or dark, heavy clothing. Age, children have a lower sweating capacity and higher core temperature during exposure to the heat compared to adults. And making sure that with kids that you're only replenishing with water. And then older age people are much less tolerant to heat than younger aged people. And then we have the difference between men and women. Women sweat less than men, which can affect the amount of water that is evaporating off of their skin from sweat. Diuretic supplements, medications, all of these can affect somebody's hydration state and can increase their rates of dehydration. Like we talked about before, if you can change practice times to avoid the hot temperatures of the day, which are typically 11 to 3, so either have a practice earlier in the morning or later on in the afternoon, that would be very beneficial. Giving more water breaks to allow people to rehydrate themselves properly. And then if you still have to modify practices, and instead of maybe doing a 2-hour practice, you're only going to do an hour practice, or modifying the time of day. Weight charts, we use these with our football players during 2-a-days when I was an undergrad. We always measured their pre-weight versus their post-weight, and we looked to see how much weight they dropped. And then we were comparing that to their next practice that they had, so that we knew if they were properly rehydrating themselves, so that they weren't putting themselves at risk for heat illness. And you're looking at, for every pound of water lost, about 24 ounces of fluid need to be replenished in order to regain that. So now we're going to get into heat illnesses. And as we go through these heat illnesses, they get progressively worse with their severity. So heat cramps, not as severe, but can still cause pretty big problems for your athlete. It's caused by excessive water and electrolyte loss during and after intense activity. Very common to have happen in calves and abdominal muscles. They'll complain of being thirsty, they'll be sweating a lot, and they'll feel that cramping sensation. And they may just have general body fatigue. The one thing to keep in mind is that their body temperature is going to be normal, and that the skin will feel moist and cool. So this is where we get into the discussion of taking somebody's rectal temperature. We know from previous discussions that rectal thermometer, or rectal temperature, is the most accurate way of measuring somebody's body temp, and so that is why it becomes very important in trying to get somebody's rectal temperature when dealing with heat-related illness. With heat cramps, management-wise, have a person stop activity, replace with fluids that have sodium in them, because we all know in order for our muscles to contract and relax, we need to have a nice balance between sodium and potassium and those electrolytes. And then moving on, we have heat exhaustion. So this is going to be the next serious thing. Usually occurs with people who are not properly acclimatized, or people who are wearing heavy equipment. So now we have to take in consideration football players with shoulder pads on and helmets on, baseball players with long pants on and maybe heavy uniforms and a hat on, which isn't going to allow them to dissipate heat as well. People with heat exhaustion will complain about being thirsty. They may present with a headache or dizziness, lightheadedness, some mild anxiety or just general fatigue, profuse sweating. They'll be sweating profusely, weak, rapid pulses, and if you take their blood pressure, if they're sitting up in an upright position, it'll be a low blood pressure, and their skin may look very ashen or gray, and it may be cool, clammy to the touch. With heat exhaustion, you will have body temperature of less than 104 degrees. So that's something that you really want to keep a note of, and if that body temperature starts getting above 104, now we're going into heat stroke, which we'll talk about next. Management-wise, with somebody with heat exhaustion, make sure you take them to a cool place, get any excess equipment off, clothing off that they don't need on, and really try and cool them off as much as you can. Getting ice bags on them, having a fan blowing on them. If you can do ice immersion, that would be the most ideal. It gives the best way of decreasing somebody's core body temperature. And if all you have available is an ice bag, you're going to put ice bags on their groin and their armpits and on the back of their neck, so that's high blood flow areas, so you'll be able to decrease their body temperature with that. It just won't be as efficient. And then return to play afterwards, you must make sure that they are back to their proper rehydrated state, and that they have to be cleared by a physician before they start going back into activity. So next we'll talk about heat stroke. And heat stroke is the least common of all heat-related illnesses. However, it is the most serious. It's actually second to head injuries as the most frequent cause of death in athletics or in activity. And this has kind of a stepwise signs and symptoms. You'll have initial symptoms that the person will present with, and then as their condition deteriorates, the symptoms are going to progress to something else. So initially they'll come in feeling just like they're burning up, really hot. And they may be mildly confused about where they're at, what they're doing. Irrational behavior sometimes, they're just feeling very agitated, and they will be sweating profusely, and they will look a little wobbly on their feet, so they're going to be a little unsteady. As the condition progresses, though, those symptoms will start becoming hot, dry skin that is very red or flushed, so they won't be sweating anymore. So now the body is turning off its thermoregulatory system of trying to cool itself down, and it's just trying to save itself. So your body stops sweating. The person may start hyperventilating or deep breathing. They'll have dilated pupils, rapid, strong pulse, and their core body temperature is going to be above 104 degrees. So this is where taking a rectal thermometer temperature can be very ideal, because you'll be able to distinguish between, is this really what the person is experiencing, or is it something else that I may need to treat differently? The big thing with this, get all equipment off, cool them as quickly as you can, and make sure that you're initiating your emergency action plan. Remember, if you're doing a cool water or ice immersion, that you have multiple people there to help in case there is an emergency when the person is actually in the cold tub. You don't want to be the only person around trying to get a 250-pound football player out of a cold tub. So make sure that you have enough people there that can help you in an emergency situation. The next thing that we have is what we call exertional hyponatremia. This is actually caused by low blood sodium. So this is a person who's been working out, and they've been relying solely on water to rehydrate. And what happens is they actually are rehydrating with so much water that it's diluting the sodium content in the person's blood. And they will present with a headache, and they'll be really confused, nauseous. They'll be cramping up. They may feel very bloated because they're ingesting so much water, and have some altered consciousness too. Significant mental compromise, so they won't know where they are, what they're doing. They'll be very disoriented, and then they may have swelling of the extremities, and they may even start into some seizures. If you ever help out with any marathons, sometimes like our Milwaukee Marathon, or if you help out with a triathlete down in, I think that's Kenosha, Racine, you can maybe see a couple of people with hyponatremia. Management with this is making sure that you're initiating your emergency action plan, and that there's specific hydration protocols that you should follow. So this could be the main difference between you're seeing somebody with that altered, confused state, the headache and everything, and you don't take somebody's temperature and you start treating them as having heat stroke. And you may delay on activating your emergency action plan and calling 911, and you just start cooling them off. Well, if you're just cooling them off and you're not paying attention to something else, let's say you took their rectal temperature and their core temp was only 102, yet they're still exhibiting these other signs and symptoms. Now you know, okay, I really need to call 911 because this is something else that is going on that can be just as deadly for the person. Last thing is heat rash. So heat rash is caused by wearing clothing over our skin, and we're working out in that really hot, humid environment, and we're sweating, and that sweat's not evaporating very well. And what happens is where that clothing came in contact with our skin, it just becomes very red and irritated. And it's kind of funny because somebody with heat rash, when they take a shirt off, it'll actually look like they still have a shirt on, but their skin is just bright red, and it's bright red where that shirt was originally. So rubia is a very localized heat rash. Profunda is more generalized and can last a little bit longer. So with rubia, that skin will be really inflamed and itchy, or what we call puretic. With profunda, people are less tolerant to the heat, due to some sort of prolonged suppression of heat loss, and this can cause higher risk for further heat illness. Management-wise, get the wet clothing off of them. Make sure that you can cool and dry their skin, and you can use hydrocortisone cream to help with some of the itchiness that they may have. And the big key to this is that the person really needs to avoid sweating, and avoid sweating for at least a day or two, and that's how long it usually takes for that rash to really subside. And if you can avoid that sweating and they don't have a problem, then they can start getting back into return to play.